Welcome, everyone. I am absolutely thrilled you're joining me for this explainer today because we're looking at something truly fascinating. We're mapping out the rigorous, incredibly demanding, but fundamentally different educational pathways of medical and dental students in Taiwan. It's a massive 6-year journey of pure dedication, but the way these two disciplines build their expertise, it could not be more distinct.
So let's kick things off with a classic misconception. Is the only difference between a medical student and a dental student just teeth? A lot of people think dentistry is simply a subset of medicine, kind of like cardiology or dermatology. But honestly, that is missing the bigger picture entirely. As we're going to see today, these two fields represent a massive philosophical split in how we approach human health, literally right from day one of their training.
Okay, let's dive right into this. Here's our quick roadmap. We're going to cover the core differences between med and dent, then look at Hurdle 1, the Phase 1 exam. After that, we're jumping into the practical combat of the OSP, and finally, the final battle, the Phase 2 exam.
All right, Section 1. Core differences between med and dent. Systemic versus localized mastery.
Now, what's really interesting about this is the sheer contrast in their daily realities. Medical students, they've got to master the entire human body, right? Every organ, every systemic interaction. Dental students, on the other hand, zero in hyperspecifically on the head, neck, oral, and maxillofacial regions. And when we look at manual skills, medical training is super focused on physical exams, emergency life-saving techniques, and big surgical decisions. But dental training, it demands what is basically extreme dual-hand microdexterity. They are essentially engineers and artists of the mouth, crafting prosthetics and operating in these tiny, wet, microscopic environments. Oh, and here's a huge difference: internship timing. Med students graduate, get their license, and then enter the hospital for their postgraduate year internship. But dental students actually do their heavy clinical internship during their 6th year of university before they even graduate.
But despite those massive foundational differences, they do share a basic structural timeline. Both are incredibly intensive 6-year programs. Years 1 through 4 are all about foundational classroom and lab science. Then, right at the end of year 4, both face their first major hurdle, the Phase 1 exam. Years 5 and 6 shift heavily into clinical work and those OSCE practical exams. And finally, post-graduation, it's time for the Phase 2 exam.
Let's move on to Section 2. Hurdle 1, Phase 1 exam, the foundation of knowledge.
So, to even pass Phase 1, medical students spend their first 4 years absorbing this unbelievably broad scope of knowledge. We're talking gross anatomy, physiology, pathology, pharmacology, micro, and immuno. They're learning how the whole machine works together. Now, dental students actually take a lot of those exact same basic medical classes, but their workload absolutely does not stop there. They have to drill down heavily into specific oral structures right out of the gate. They're studying oral anatomy, oral histology, and embryology, and they focus really heavily on dental materials. They literally need to know exactly how different metals, ceramics, and composites will react inside the human mouth.
And that Phase 1 exam perfectly highlights that whole systemic versus localized rule we just talked about. The medical exam, which is split into Med I and Med 2, covers 8 broad basic sciences. They get tested on everything from biochemistry and anatomy down to parasitology and public health. Meanwhile, the dental exam, Dent I and Dent 2, is highly specialized. They're tested on specific oral biology, dental morphology, which by the way means knowing the exact shape of every single tooth in the head, dental materials, and dental pharmacology. But for both of these exams, the stakes are exactly the same. Students absolutely must achieve an average score of 60 points to pass and move on to their clinical years.
All right, Section 3, Practical Combat, OSC, the Clinical Skills Test.
For medical students, the OSCE is this rigorous gauntlet covering all the core departments: internal medicine, surgery, OBGYN, peds, you name it. They interact with standardized patients who are basically actors trained to simulate specific illnesses. And the examiners are standing right there, watching to see if the student can take a really thorough medical history, perform a systemic physical exam, and use their clinical decision-making to nail down a differential diagnosis. They also have to prove their physical skills on models, like showing they can safely draw blood, suture a wound, or do an intubation. It's all about that holistic, big-picture, life-saving patient care.
Let's look at how this builds for dental students, because their OSCE is uniquely split into 2 distinct steps. Step 1 is kinda similar to the medical students. They also interact with standardized patients. Here they're tested on taking a dental history, explaining really complex treatment plans, and navigating medical ethics, like what do you do if a patient just outright refuses treatment? But step 2, that is where it diverges wildly.
This is the simulator or mannequin stage. Here, they are tested on pure, unadulterated manual technique. They've got to demonstrate perfect infection control, execute dental restorations, which are basically fillings, perform complex root canals with rubber dams, and do periodontal scaling, all under super strict time limits.
And we really need to pause on this concept of mannequin simulation for a second. Why is this absolutely crucial? Well, because in dentistry, a single millimeter of error can mean irreversible nerve damage to a patient's tooth. So this intensive, grueling practice on dummy heads ensures that a student has totally perfected their spatial awareness, their instrument control, and their manual dexterity. I mean, they literally have to learn how to use a tiny mirror to see backwards and upside down while operating a high-speed drill. This strict simulator requirement ensures their hands are perfectly steady before they are ever allowed to touch a real live patient.
Moving right along to Section 4, Final Battle, Phase 2 Exam, Clinical Application and Licensing.
To prep for this final exam, daily life in years 5 and 6 shifts dramatically for everyone. Medical students are doing holistic rotations through the hospital's major clinical departments. They're learning systemic disease diagnosis right there on the ward and observing intense surgical decisions in the OR, basically getting ready for their post-grad hospital rotations. Meanwhile, dental students are already fully immersed in their heavy clinical internships. They're rotating through oral surgery, endo, perio, and ortho. Because their internship actually happens while they're still in school, their final years are this massive, intense mix of actual patient care under supervision, plus even more advanced mannequin simulation.
So the crucial point is how all of this culminates in their final Phase 2 computerized exams. For medical students, this test covers Med 3 through 6. They're tested on complex clinical cases in internal medicine, pediatrics, surgery, OB/GYN, psychiatry, the whole 9 yards. For dental students, their test covers Dent 3 through 6, facing complex clinical scenarios in endodontics, maxillofacial surgery, orthodontics, and dental public health. Both groups face the exact same unforgiving rule. You need an average of 60 points across the 4 subjects to pass. But here is the absolute most brutal part. If you score a 0 on even a single subject, you automatically fail the entire exam, no matter how high your overall average is. Bam, you fail. It's a staggering amount of pressure that demands well-rounded excellence across the board.
6 years. 2 absolutely distinct paths. Both sets of students endure an unimaginably grueling gauntlet of exams, late-night studying, and intense pressure. But their end goals shape literally every step of their journey. One path prepares the mind for whole-body systemic care. The other path trains both the mind and the hands for hyper-precise, localized manual mastery.
I want to leave you with this final, provocative thought. While they share the title of doctor, their ultimate canvases, the complex systems of the whole body versus the hyper-precise mechanics of the oral cavity, demand entirely distinct forms of mastery. It really makes you appreciate the immense specialization required in modern healthcare, doesn't it? The next time you visit a hospital or sit down in a dentist's chair, you'll know exactly the 6-year crucible that person went through to be able to treat you. Thank you so much for joining me on this explainer. Keep learning, keep asking questions, and I'll see you next time.